Hello and welcome to today's WorkSafe Month webinar, HSR panel discussion, Making Positive Safety Change in the Workplace. I'm Stephanie Morawski from WorkSafe Tasmania and I will be your moderator. Before we start, please take a moment to read the following slide about information received today. I'll now go over housekeeping. Here is a screenshot of the attendee control panel. You should see something that looks like this on the right hand of your screen. You're likely listening in using your computer speaker system by default. If you would prefer to listen over the phone, just select telephone in the audio pane and the dial-in information will be displayed. Webcams and audience microphones will not be used in today's presentation. Questions will be taken at the end of the webinar. Please use your control panel to type and submit your questions. Finally, today's webinar is being recorded. I would now like to introduce your presenters. Jessica Munday, Secretary, Unions Tasmania. Jessica is the leader of the trade union movement in Tasmania. Elected as Secretary of Unions Tasmania in 2017, her organisation represents approximately 50,000 workers across the private and public sector. Jessica is an experienced industrial relations and work health and safety practitioner. Before leading Unions Tasmania, she worked with the Community and Public Sector Union for 12 years, including 3 years as the Regional Secretary of the branch. Jessica is also a Trustee Director of Industry Superannuation Fund, TasPlan, a WorkCover Tasmania Board Director, and President and Treasurer of the Community Legal Centre Worker Assist, which assists injured workers navigate the Tasmanian workers' compensation system. I would also like to introduce your HSR panel for today. Scott Plimpton, Support Officer, Services Australia Centrelink, Sandy Petit, Education Facility Attendant, Ogilvie High School, Mark Mann, Plant Operator, Mondelez International Cadbury, and Phil Kushka, Intensive Care Paramedic, Tasmanian Health Services. Welcome everyone.
Thank you very much, Stephanie. It's Jessica here. Thank you, everybody that's taken the time to join our HSR panel discussion today. I'm only going to talk for a little bit at the beginning before I throw over to the people that I'm assuming you're really here to hear from. Before we begin, I would like to acknowledge that we meet on Indigenous land and pay my respects to the Tasmanian Aboriginal community as the traditional and continuing custodians. As Stephanie said in her introduction, Unions Tasmania represents workers in this state, and we work very closely with health and safety representatives, union delegates and workers to make sure our workplaces are as safe as they can possibly be. I want to talk a little bit today about the role of health and safety representatives and the primacy they have under our Work Health and Safety Act and how critical they are to making our workplaces safe. But before we get really stuck into it, there's just a quick poll. We'd really love to know who is a health and safety rep that's listening in today. So Stephanie, would you be able to launch that poll, please? So just yes or no, are you a HSR?
We'll close the poll shortly. I'll close the poll, Jessica, and share the results.
Okie dokie, so there we go. We've got the results. 36% of people on here are HSRs, but the majority are not. So I hope that means that we're all here interested either in making sure our workplaces are consultative or potentially include health and safety reps, how you could include them, and how you work together well. So I've just got a couple of quick slides before we throw to our HSRs. Why HSRs are important. They are a key component of our work health and safety system. And actually our Act, our Workplace Health and Safety Act, our model laws, establishes a really prime role for HSRs, and it's built upon principles of workplace representation, consultation, cooperation, and issue resolution in relation to work health and safety. So basically what that means is our Act tries to bring all the duty holders and all the parties in the workplace together to resolve issues in cooperation with each other. It certainly sets out processes for when this can't happen, because obviously it's not always possible to agree on things in an easy manner, but that's what it tries to do, and that's why health and safety reps and deputies are so critical, because it recognises the need for a worker voice in health and safety, and it recognises that when workers have input, often through HSRs, and particularly before decisions are made about health and safety matters that might affect them, your safety outcome is likely to be better. Our Act also has a number of, or it sets out the powers and functions of HSRs. And look, there's a big dot point list there. You can all read that. A couple of points I'd like to make, though, about that is if you're working with HSRs in the workplace or you're a HSR yourself, you need to be really familiar with these functions and powers. And you need to be aware that it is a breach of our Act to not facilitate or allow HSRs to perform these functions or powers. Where we often see some confusion about the role of HSRs is, what is their role? And it isn't to be a safety cop. It is not to take on the duties of the person conducting all the business or undertaking. You don't even have to be a workplace health and safety content expert or responsible for ensuring the PCBU does everything, though you play an important role in making sure they do. But a HSR's real role is to provide that collective voice to the work group about work health and safety, and then share that with the PCBU. They're there to make the employer transparent and accountable to workers as to how they deal with matters. So we would often advise HSRs that a majority of their time should be spent talking to work group members, and hopefully a smaller amount of that time consulting with the employer. So you've got a role, a really important role HSRs do in educating and skilling up workers to have the voice on work health and safety, and that's really important. In terms of duties to HSRs, if you're a HSR, there are some things that you do get from the PCBU to help you to do your job. So I've listed again, we've listed them there for dot points, but some extra things that we would add is you do get paid training, and this is really important. Training is accredited by WorkSafe, and Unions Tasmania is a provider of that training, and there are a few of them around in Tasmania. But you get 5 days of an introductory course so that you can be educated on all of the things you need to know that are your duties and responsibilities as a HSR. You must request the training though. Everything is on request in this Act. So training is on request, and election for HSRs is on request. Your work group doesn't have to have a HSR, but we would recommend they do. However, if workers in that work group request one, then the employer must facilitate an election. And there are rules about how that should be conducted so that everybody gets a vote and people are not just handpicked, but everybody gets a say. Again, you don't have to have training, but if you request it, you must be released to a course of your choosing in consultation with the employer. And then you'll be elected for 3 years. Only trained HSRs can direct workers, though, to cease work or lodge a PIN. And deputy HSRs can be really important, and they can only lodge a PIN in the absence of the HSR in their workplace, or if that HSR hasn't done their training course. So these are some things that are really important for you to keep in mind as HSRs. Have I been trained? Is it current? Am I getting my refresher a year? Because you can have refresher training for 1 day a year so that you can stay current and so that you can build networks with other HSRs. So this is all information that HSR should know as part of continual learning and contributing to the positive safety culture in their workplace. And that's what we're really about. We're really about, and the Act is really about, HSRs being that conduit, the voice for workers, sharing their information and knowledge, raising issues with the PCBU, and then getting involved in a multitude of ways in the workplace that will improve safety outcomes. So without further ado, I'm going to throw to our first HSR, and Stephanie's given an introduction, so I'll just ask Scott to further introduce himself and to tell his story. Before I do that, Scott, I'd just ask everyone to know that all of these HSRs do these roles voluntarily. They're not safety professionals that give presentations every day. They're here to share their experience from their workplace, and for that, Unions Tasmania is really thankful. Obviously, COVID has influenced the way WorkSafe Month is being run. We would often have a conference for HSRs each year in face that we haven't been able to do this year. But the reason we've put this HSR panel together is one of the most common pieces of feedback we get from our conference attendees is that HSRs in particular like to hear from other HSRs, and they like to hear examples of what's really happened in the workplace and how issues have been tackled and how difficulties might have been overcome. So that was our intention in putting this webinar together for you, and I'll hand over to you now, Scott.
Thanks very much, Jess. Hi, everybody. Yep, my name's Scott Lipton. I'm a service officer with Services Australia, who operate Centrelink, Medicare, and the Child Support Agency. I work at Centrelink. We've got about 700 workers at 188 Collins Street, where I am situated. As part of the Australian Public Service, we're quite lucky in that work health and safety culture is given a very high and visible priority across the agency and across the whole public service. I was elected as an HSR about 15 months ago, and I've been a CPSU delegate for around 3 years. My patch as an HSR is the floor that I work on at 188 Collins, which is about 120 workers and managers. As far as an interesting sort of situation we found ourselves in was earlier this year, we had CPSU delegates and members raising issues that buses full of quarantine passengers from the airport were being offloaded at the entrance to our office building, which is actually the largest office campus in the state. These quarantine passengers were walking up the footpath from our building to the hotel next door, where they were to stay for 14 days. As HSRs, we raised this with our agency management. They didn't seem to be particularly interested in the issue, as they saw it as a building owner issue. There are many other tenants in the building, and these tenants, private enterprise and government, made inquiries to the building manager. HSRs, after we got the pushback from management, we raised the issue directly with the CPSU organisers. They contacted building management on behalf of the members and the other workers. The building manager then contacted the state government after numerous contacts from government and private tenants. This went up to and including the Premier's office, with no response or acknowledgement, really. At this point, the CPSU organisers enlisted Ella Haddad, our state Labor member for Clark. She made inquiries as a local member with the State Control Centre and the Premier's office, all with similar lack of response or action. The CPSU and Ella then contacted the media, resulting in a story on ABC News, followed by the Mercury. Approximately 2 weeks after these media reports and a few more ongoing, the buses suddenly stopped arriving, and it was discovered that the government had stopped using that hotel. We actually didn't receive any correspondence advising of that. The buses just suddenly stopped arriving, and we worked out that they'd been moved to a hotel up the road. So that was quite a win in what could have been a potentially dangerous situation. I feel the key factors that made this a successful operation was just the level of consultation that we had between union members and delegates, HSRs, union organisers, and of course a local MP getting on the media was very helpful as well. The top lesson I learned from this is you need to be dogged and pursue your end goal. If approaching your employer winds up in a dead end, speak to your union organiser who might be able to suggest other avenues to go down. I'd also say to employers, HSRs are there to help your business by being ears on the ground for any potential safety issues, and they need to be listened to. If your HSRs are also union members or delegates, then they've got the added advantage of further training and backup in terms of advice. That's about all I've got to say. Thanks very much, Jess. I hope that was informative for attendees.
Thank you very much, Scott. Appreciate you sharing that story. And I would say we, of course, will take questions, but we're just going to hold them off until the end. So we'll let all the HSRs speak. And if you've got questions, send them through. If you want someone in particular to answer them, note who that would be. Otherwise, we'll figure that out at the end. So excellent. Thanks, Scott. I'm now going to pass to Sandy, who will introduce herself.
Hi, I'm Sandy Pettit. I'm an EFA at Ogilvy High School and was elected HSR about a year ago. Just before I get started, I'd just like to say this is my first time doing speaking. I'm a little bit nervous, so please bear with me. So we've had a lot of issues with not having cleaning products at the school. I should explain that me being an EFA, I do the cleaning at the school. We do vacuum cleaning, mop, dust, toilets. I represent the EFAs at the high school. Stuff, I'm not exactly sure about. I think we have 7 to 8 EFAs at the school. All up, I think there's about 400 students and staff at the school. The issues we had were we had no disinfectant to do the cleaning of the equipment. We were told we didn't need it. We also didn't have the proper toilet cleaner and decent garbage bags, which we were told that cheap is better. This made us feel we were a bit stressed, felt like we were being bullied, being watched all the time. We brought in the union, who came in on a WHS entry permit, section 117, who did an inspection report inquiry into a suspected unsafe work environment and systems of work with myself and Lenny, who's a union delegate. We sent the report to Duncan, who is the principal at the high school, who had no idea that things were as bad as they were. He then gave Lenny, the union rep, and myself the authorisation to go and order the chemicals and products that we needed to keep the school clean and sanitised for all the staff, students and visitors. I didn't know any of this could be done until I did the HSR course. It's given me the knowledge and confidence to keep going and making it a better place.
Is that you finished, Sandy?
Yes.
Excellent. Thank you. And thank you so much for sharing that. And I appreciate you saying that you were nervous. As we said earlier, this is some people's first time sharing their experiences HSRs, and we think it's really valuable. So thank you very much. We really appreciate it. Now I'm going to hand over to Mark. Without any further introduction, Mark can tell you about himself and what he does at Cadbury. Thanks, Mark. You may need to take yourself off mute, Mark.
How's that?
You good to go, Mark?
Yep, can you hear me now?
Perfect.
Lovely, lovely. Okay, thanks, Jess. I work at Cadbury's and have done for the past 35 years as a confectioner, making everything from the old flake that used to fall apart when you try to eat it to making the glass and a half, which I currently do now. Cadbury's Claremont is actually 100 years old now, and we are celebrating that milestone this year. And while things have changed from the small factory it once was, it has transformed into a larger, much larger company competing on a global market. Our factory runs 24/7 and employs over 300 people. It's busy all the time as we have raw goods coming in from all over the world, even 40-odd farms that supply us with milk coming in from Burnie daily, all to make the chocolate we love to eat. At Cadbury's, we had and continue to have a strong safety culture. As for as long as I can remember, there's always been an emphasis on minimising risks and making sure we not only look after the outside of our body, but look after our health and well-being. At committee meetings, which are run every month, or in some cases twice a month during the COVID period, we discuss general matters, but also talk about traffic management, well-being or mental health programs which could be on the agenda. Unions have thoroughly supported these actions and work closely with the company. Me personally, I have been a HSR and a delegate for over 20 years and have always played an active role in safety and most recently mental health and developing risk assessments. Mental health is something we have been focusing on at work closely. With the added pressures of our daily lives and targets that need to be met, it doesn't matter if you're a worker or a manager, sometimes it all gets a little bit too much. So we have to have some regular themes and support measures in place, and most of the time I find all it takes is a coffee and a chat to start the positive vibes when someone's feeling not right. My latest test has been developing risk assessments from scratch, and while I was very nervous at first, it is now enjoyable, and with the right training I'm able to assess each task and minimise the risks. In a lot of cases, eliminate the hazard. I recommend any HSR or manager to explore this line of training. The benefits are absolutely huge, actually. I'm very lucky in the fact that all this is encouraged by my managers and to take on these extra tasks off the job as it benefits us all in the long term. And a good example of a large win that we had. A few years ago, I was working in a confined space with a small group. The space entered was tall, cylindrical, and had a small opening. We have always complained about the entry and exit as it was awkward and concerning if there was a need to evacuate someone. I ended up raising the risk with my manager and team leader on numerous occasions with no luck, as was told the cost would be a barrier to getting it fixed. So I used the safety committee meeting that we have every month to raise it as it's represented by HSRs and managers, and even our factory manager. The next day, the very next day, our factory manager decided to investigate the hazard, and within 24 hours, the money was approved and work commenced. We have all our similar confined spaces modified, and not only did it minimise the risks of confined space, but 90% of the works can be done from the outside now, eliminating the need to enter. And as I've got a few tips for some HSRs. Okay, being a HSR is what you make of it. Me personally, I'll put my hand up for extra training around mental health, risk assessment training, and even achieve a Cert 4 in OH&S, which is very rewarding in itself. They all give you added confidence when assessing hazards and risks. But most important thing is don't give up. Even if you don't fix something the first time or you seem, why bother? Nobody's listening. There's a lot of resources out there, and a little bit of consultation and the right person goes a long way. And a tip for employers. This is an easy one, actually. Consultation and inclusiveness goes a long way with dealing with safety concerns or incidents in the workplace. And of course, training. A well-trained safety team can be a huge asset. Not only a HSR trained, but a mental health and trainer gives a HSR a lot of confidence in understanding issues that they're having in that conversation with colleagues. And that's it for me.
Thanks very much, Mark. I really appreciate hearing that. Cadbury's would be a very interesting workplace with a lot of unique safety issues, and I think it's one of the workplaces where that we've seen because of yourself and the team there that health and safety committees and well-trained HSRs can achieve a lot. So thank you. Now it's over to you, Phil, our last HSR.
Hello, my name's Phil Kroschka. I'm a intensive care paramedic with Amherst, Tasmania. I hope you can hear me. I hope you can all hear me.
I can hear you well.
Thank you. Now, my history, I've been a HSR in 1993, 1998, 2003, 2007, 2013, 2018. I had a break there somewhere, about 6 years. So I'm very interested in health and safety. My work group consists of about 150 workers, possibly a few more. They're actually day workers and shift workers. Also, they consist of part-timers, casuals, and full-time people. Age range, probably from about 20 years of age up to about 60 plus. They cover from different areas. Not all people work out of Hobart, so we've got Bridgewater, Kingston, Mornington, and of course Hobart. We have 3 HSRs for this area and 1 deputy HSRs, and we're just been through elections for this to take place. Our safety culture with Amherst, Tasmania, I would describe it as being reactive. So you're always waiting for an accident incident to happen before any changes are made. Now, I'll be talking about ramping. This is a example of a reactive service. There have been slight changes from an audit that was done in 2018, where the audit probably ranked about 2 out of 10. So a lot of changes had to be made to make sure that they're compliant with the audit. Generally, Amherst safety is okay. Amherst has invested a fair bit of stuff into like training, safe work procedures, safety policies, fatigue policies, adequate brakes, safe vehicles. We have safe clothing as well, and also good stations to work out of. However, there needs to be with the safety culture, there needs to be a lot more improvement done in consultation. So about sharing information, also getting staff to view their views put across. Also, staff to actually invest in decision making. So we're out there doing the job. So a lot of these staff have good ideas on how to fix things and solutions how to fix things. What has improved a lot, and Amnesty has been very, very proactive, which is fantastic, is with the pandemic response. Now, the reason why I do the HSR role is to get out there in the workforce and listen to ideas and from our workers who and just talk about safety in general. They're fantastic. They've got ideas, they've got solutions. So that's where we get a lot of our ideas to take back to management on how to fix problems. They're to represent workers and have a voice for workers who won't speak up about safety. There's quite a few younger generation or people who are in their training regime of their work life, and they want to get a job at the end of 3 years. So these sort of people sometimes won't talk about safety. There to investigate complaints, also promote safety awareness, and also do this through being out in the field and also through newsletters. Now, I've just got a newsletter in front of me right now, which is about to put out to our staff in the next couple of weeks. And what it says on just gives a topic. It says paramedic safety. So this newsletter is just advising staff on where to actually report hazards. So the first point of call is actually go to a duty manager for any single safety event. Also, we have a safety reporting learning system. It's called SRLS, which is a computer-based system where they can enter any hazards, near misses, and also any process or equipment failures. With this newsletter, I've just put the functions of also health and safety representatives. We don't get access to this safety alerting system, so we don't know what hazards and also near misses that happen in the workplace. The newsletter also goes through the definitions of near misses. It actually gives a definition of near miss which is related to the work that we do. So I haven't gone to a book to find out what near miss is. I've actually related to what's actually happened in the workplace. Also, we look at process failures, equipment failures, and hazards in general. So all the hazards relate to the work, and these are common hazards that happen. I've also looked at, on this newsletter, to the hierarchy of control of hazards. Now, with ambulance, our workplace is everywhere. When we go to work, we actually go into the ambulance vehicle, and also we go to a station. When we get a job, we go out in the community. So we go to people's houses, we go to industrial sites, we go anywhere. So really important that in our minds, we actually look at different sort of jobs we go to and what hazards can actually harm us, and how we can actually not have these hazards or these incidents happen and we get hurt at work. Now that's just a newsletter that I was going to put through to staff in the next couple of weeks. Also, I'll be consulting with other HSRs to get their ideas as well. So, like I say, also another reason why I actually do HSR work, because I have my own small business. Now, having a small business, I've got regulations that have to be compliant with the Work Health and Safety Act as well. So I'll probably come under an officer under the Work Health and Safety with my small business. So doing HSR work keeps me involved in safety and also processing on what's actually happening. So it keeps me up to date. And my main aim as an HSR is keeping safety simple. Also communicate, speak up on safety issues, gain and promote mutual trust with all stakeholders, including management. represent workers, and just focus on a safer workplace and work together. Now, moving forward from this, so my topic today is ramping. Now, ramping is a funny term. It doesn't really mean a lot. So I'll just give you a rundown on what I'm going to talk about. I'm going to talk about the definition, about our workspace that we have to work in, our hazard reporting systems, how HSRs tackle hazards associated with ramping, and also the outcome. So hold on a sec, I'll have a drink. Okay, definition of ramping is ambulance ramping occurs with ambulance officers or paramedics are unable to complete transfer of clinical care of their patient to the hospital emergency department within a clinical appropriate time frame. This is due to the lack of an appropriate clinical space in the emergency department. In some jurisdictions, ambulance ramping is also referred to as off-stretcher time delays or ambulance turnaround delays. So generally, the ambulance actually, just give me a sec, phone's ringing. The ambulance, we go out the community, we pick up our patients who are sick and injured, and we care for our patients through to the hospital. We get to the hospital and we take the patients out of the ambulance and into the hospital environment where they get triaged to work out what category patients they are. If there's no space in the at the hospital, then we actually go into a location which is called ramping. So we actually have to treat our hospitals. We have to treat our patients on our stretchers or on hospital beds in a workspace, which is separate to where the nurses work and also where the doctors work. Now, I'll just quickly go over our workspace. Our workspace that we work in the hospital is 2 meters wide. It's actually a corridor that extends probably, some corridors go for probably about 10 meters, some go for 20 meters plus. When we actually got a stretcher, when we have a patient on a stretcher in this area, our workspace decreases to 1 meter. In this corridor, it's a thoroughfare for hospital staff to actually go to toilets, go to the locker rooms. So it's a thoroughfare. It's a thoroughfare for where patients come out of the resus area and are transported up to other wards. It's a thoroughfare for patients who have been diagnosed with infectious disease, and they actually get transferred through this corridor up to other parts of the hospital as well. It's also an area where relatives, a grievance area for relatives to go, where relatives has either passed away or been seriously injured. So this location where our workspace is actually involves that area as well. Now, in this workspace, we just reflect back to how wide it is. So it's not very wide, and also, but it's long. If we get 10 ambulances ramped at the hospital, that's 20 paramedics and 10 patients in the corridor. So therefore, it's a very cramped space, and also causes a lot of issues regarding safe workplaces. Creates a lot of issues regarding hazards, regarding what we actually do, the work we do in this area. Major hazards that we get are mental tasks, body stressing too, like bending, awkward positions, twisting forces, muscle strains, prolonged postures. There's no seating in this area, so we have to stand most of the time. There's also the work we do is sedentary work, so we're actually standing there in some cases for maybe 12 hours of a 14-hour night shift. So that causes a lot of problems, especially for our mental health. It causes a lot of stuff for physical stresses, physiological stresses, and also mental health. Just covering the physiological stress, we're exposed to grieving relatives. We get assaults on paramedics in this confined space area. We have fatigue, mental health issues. We get hungry, physically sick due to lack of breaks and long ramp times. We have poor circulation, so you have all these people within one area. So if they start coughing, sneezing, farting, it's not very nice. We find that also being in these areas, patients deteriorate in our care as well. So we haven't got access to our emergency equipment like resuscitation equipment, medication, suction, oxygen, because we're in a corridor. We're exposed to biohazard patients, like exposure to flus, gastros, and so forth. In the early stages of ramping, we didn't know if the hospital beds were clean or not. So we had to do a lot of hazard reports on who's cleaning the beds. We have near misses in this area because it's a cramped area. We have a lot of people in this area. So people are actually getting bloods taken. So we've got problems of sharps and this sort of thing. Accidents happening. We had oxygen bottles falling 1 metre from the actual hospital beds onto concrete floors, which doesn't go well if the actual oxygen cylinder ruptures. It's an emergency evacuation area to get out of the hospital. There's no hand washing stations. So there's plenty of hazards regarding ramping at the hospital. I must say, I'm only just talking on this as a paramedic perspective. Ramping causes a lot of other issues for other health services, as in the nurses, also doctors as well. So, how we report hazards. This is the general way we report hazards. We report them to our duty managers, line managers, for any hazards that happen in the workplace. Also, we use the safety reporting learning system, which I mentioned earlier, which is SRS. Health and safety representatives do not have access to the SRS or get told about hazards that go into the system, which is really probably we should know about these hazards that happen every day. We also report hazards through safety committees. We have a safety committee on today. Also, they're probably once every month, the safety committees. We report these hazards through the union, WorkSafe Tasmania, and also through the media. Now, ramping is been going on for a long time now, probably since early 2000. And really, the hazards that I've mentioned there hadn't been addressed that well right to about 2018. So the way we tackled hazards was HSRs carried out a risk assessment on ramping. And also, it's not really up to HSRs to carry out risk assessments, but we did. We found that nothing was actually happening. The conditions were getting worse. We also carried out step-shop surveys. Step-shop surveys are actually, you grab a survey, grab a bit of paper, put a whole lot of questions on a bit of paper, and then you just walk around and speak to your workers on different, how to use a hospital bed, have you used that sort of thing, have you had training in this? So it's just a snapshot there, so you can real life stuff, not a computer-based thing. We instigated a monkey survey on mental health. Now, the results from this survey was appalling. The mental health issues we were having at ramping was atrocious. Now, we've raised all this through. Now, when we raise all these issues, we need to try and get some sort of solutions to something else happening with it. Nothing was happening. We raised it through the SLS system, we raised it through our managers, nothing was getting done. Probably small bits. They were trying different things, trying to make it safer, to be fair. So we ended up having a workplace accident down there. So pins were put in place. A pin was under Section 90 of the Work Health and Safety Act. Now, when we put a pin in, we had learned from this one. When you put a pin in, you put a pin on individual items. We didn't. We put a pin on multiple items. So that was our mistake as HSRs. But also there's a learning aspect on how pins work as well. From the pin, nothing happened. So the department did a risk assessment, and what we found is a lot of the risks some of the risks were in the extreme level. So when the extreme level, we shouldn't be doing the job at all. So after that, we went to a stop work action, which is under Section 85 of the Work Health and Safety Act, where we're going to stop work, go into our ambulances, we can't ramp in the actual tunnel at the Royal Hobart Hospital. This is due to public build-up of gas, diesel fumes if we need our engine running. But so then we would have had to have gone out onto the street and ramp the ambulances. Now, to ramp ambulances, there might be 10, 15 ambulances ramp up a street. So that's going to cause problems to the public as well. We based our stop work action on a mental health survey that we did, a snapshot survey that HSRs did, a SACMA workplace accidents that happened in the area, provisional improvement notice that nothing happened, also the Department of Health risk assessment where we had the extreme risks. We did based on our risk assessment that we did as well on the audit that was done in 2018, 18 years of raising risks and hazards associated with ramping. The 2000 summit was actually organised between leaders of the health system and also some workers as well, which didn't address our safety issues as paramedics. It also witnessed to dying and deteriorating patients in our area. The outcome of the stop work action, we actually got some action done. It was fantastic. The Secretary of the Department of Health instigated meaningful consultation between all stakeholders. Now this was fantastic. We also then we got rid of the stop work action. We got policies, procedures, safe work procedures put in place. Staff received training on hospital equipment and emergency procedures, just to name a few. Now, this is currently from the last couple of months, WorkSafe has doing an investigation on ramping, so I can't comment any further on what's happening from there. Also, ramping is still a big issue, and especially the hazard of being exposed to infectious patients in a pandemic world. Thanks for your time. Thanks, Jessica, for that.
Thank you very much, Phil. Appreciate that. That's probably an issue that people have heard a lot about because it has been covered in the media, but interesting to hear about that from a HSR's perspective. Look, that wraps up the presentations from our individual HSRs. I'll just would like to thank all of them again and thank everyone that's listening and probably say this, that we'd asked these HSRs in particular to come and share what had happened in their workplace because they had some issues that were difficult to overcome and traverse the range of things that a HSR might do, from consultation right through to stopping unsafe work. We do acknowledge, though, that there are plenty of good employers and great workplaces that have got a good safety culture, and you might listen to this and think, oh, that wouldn't happen here, and probably perhaps not, because if your employer is supportive of health and safety, then they're encouraging you to come to excellent things like WorkSafe Month events. But being a HSR can be a tough job when there are difficult issues or when there's a reticence to resolve them or a whole range of factors. And I think the HSRs here presented a different range of factors for why things progressed the way they did in their workplace. So what I would say is I think there they all demonstrate that there's a great benefit in having HSRs, and that they are a really valuable source of information, source of consultation, and a valuable ally in improving safety outcomes in the workplace. For those of you that are not super familiar with our Act, our Work Health and Safety Act, Part 5 is your friend, I think. It is around sort of consultation, but also deals with health and safety reps, their powers and functions, anything to do with them. That's our go-to when we're talking about health and safety reps, how to elect them, what they can do. It's Part 5 of our Work Health and Safety Act, and we're always happy, Unions Tasmania's always happy to take questions, particularly from HSRs, to call us if you've got any questions about your role. So look, Steph, I'm going to wrap that up because I'm conscious that it's quite close to 11 o'clock, and just see if there are any questions for our HSRs.
Thank you, Jessica, and thank you as well to our HSR panel members too. So if you do have any questions for our panel members today, or Jessica from Unions Tasmania, please write your questions in the questions window on your control panel. So a couple of questions and comments have come through. Jessica, you may wish to respond to these initially. So the first comment is work health and safety discussions with managers during COVID-19 were really good and productive. They included union reps and first aid officers. However, this discussion has now decreased significantly.
That's a really good point, and that's very disappointing. And I think it goes back to the way I look at it is around the whole sort of question of safety culture. That's what our observations were at Unions Tasmania, and obviously we saw the gamut of good, bad, and ugly, and all of that. Is that when there was a health and safety issue, that employers were able to be reactive. Many of them didn't have structures in place and forums in place and processes in place to deal with systematised issues around safety. So they dealt with COVID, which was completely appropriate, but it made a number of HSRs, workplaces, etc., look at their systems around that and go, actually, that was a really reactive response. We don't have a system for regular consultation. We don't have a HSR. We don't have work health and safety on the agenda at our toolbox meetings or our staff meetings. So my approach to this would be to start talking to your work group or to your union if they can help around putting those structures in place to make sure that it continues. And so whether that might be the establishment of a health and safety committee, the election of an additional HSR, a look at the work groups to see if it's appropriate, putting work health and safety as a standing item on your staff meeting agendas. There are lots of ways that I think we should continue to try and use COVID, which has been really difficult, to learn some things about safety in our workplaces. So they would be my sort of top tips. And what I would say too is that there may be an element of complacency because of Tasmania's relative success with COVID and the low caseload, but we are really concerned that we don't want to forget the good habits that people have put in place, and that workplaces still, and WorkSafe would, I think, probably back this up, is that they've still got a really important role to be vigilant around this as a risk, and it might be a higher risk depending upon your nature of your work and the type of workplace you're in. But COVID hasn't disappeared, and we shouldn't be accepting a return to the old normal if the old normal meant not that good communication around safety.
Thank you, Jessica. Another comment. Our workplace does not acknowledge the psychosocial hazards caused by lack of resourcing and are often dismissed.
Yeah, look, this is a really, I might also ask Bill if he wants to respond to this, but we have a view that there is a real gap in our legislation and our guidance around psychosocial hazards. So Unions Tasmania and the union movement broadly wants to actually see some guidance in the form of a new regulation put around psychosocial hazards and how you deal with them, because I think the example that the person asking the question has given is very real. And it's across particularly in lots of public sector areas, but also private sector areas. And it is still an area where, it's not as apparent always as to the solution, and it's not always taken as seriously. So, but we should remember in saying that the duty of care to provide a safe workplace that the PCBU has applies to physical and psychosocial hazards equally. I'm not going to say that it's always tackled as well, but you should still have the confidence that in addressing or trying to get through and address those issues, that you are absolutely entitled to be pushing for protections and responses around your mental health and psychosocial safety as much as physical hazards. And it may be that where you're unable to resolve issues at a consultative forum, for example, and resolve them easily, that you do need to look into other mechanisms, like exercising your powers around, or working with the union around powers of inspections and, PINs, and seeking the assistance of the regulator. That's what they're there for as well. So I hear you. I wish I had the easy answer, but I think all I want you to do is consider that you are on the right track. You are entitled to raise this, and all of those measures that are available to HSRs to pursue physical hazards are there for psychosocial hazards as well. It's just I can completely appreciate that you've come up with barriers, because I've seen those as well. Phil, did you want to add anything there?
Could someone just ask me the question again? Tell me the question.
Yes, absolutely. So the comment was, our workplace does not acknowledge the psychosocial hazards caused by lack of resourcing and are often dismissed.
I hope I can answer this correctly. With Amherst Tasmania, they've been specifically, they've been very proactive in getting like peer groups in, peer support groups in. They get in employee assistance programs for mental health and for people struggling in the workplace, for all sorts of things, even critical incident stress management processes as well, for Amber's perspective. Now, they're all well and good, all workplaces need it. But the only thing is they don't fix the actual hazard. It's actually on when it's actually happening. So then the risk assessments have to come into place. People actually speaking up on safety, what's happening in the workplace regarding psychosocial hazards. It's a very hard area to fix, but you really need to get everyone on board, all your managers, down into the area and look at what's actually happening and how we can work together to actually try and fix and make this solution a bit better. It's probably all I can answer in that area. So.
Thank you, Jessica and Phil. A question. You have aligned the HSR role to that of a delegate. It is not clear, however, from this presentation that the HSR role is a non-union associated role. Can you please clarify?
Yeah, absolutely. Union delegates are separate to HSRs. Some of them might occupy a HSR role, just like any employee in the workplace could if they've been duly elected. I thought we did make that clear at the outset that HSRs are elected under the Act. There are processes under that Part 5 of the Act that stipulate how they are elected, and that they are elected and that everyone has an opportunity to be a HSR. So no, the HSRs are themselves a particular legislative role under our Work Health and Safety Act, which is very different to how union delegates are elected.
Thank you, Jessica. And it's another question which was touched on at the start, but if you could sort of go over the point again. From this discussion, I've learned how important a health and safety rep is. Nevertheless, I hear a work health and safety rep is not compulsory by law. Is this true?
Yes, that's true. You're right. We think that we certainly think they're really important and can play an important role, particularly if they've been trained and there's a real appetite from the workplace to build a culture. Then I think they're critical there. But no, they're not compulsory. However, as I said, the Act says if the workers in the work group request a HSR, then the employer must facilitate an election.
Thank you, Jessica. Mark, a question has come through for you. How have operations at Cadbury changed over time, and has technology made your work safer? Mark, how have operations changed over the years, and has technology made your workplace safer? Mark, I think you might have your mic on mute.
Yeah, I did. Sorry. Technology has made a difference. It's like every business. You've got to move forward. We have machines doing, our production's a little bit more than what we used to years ago. Of course, where that happens, we risk assess everything that comes in. All our jobs are risk assessed, and from a safe point of view, I think it's got safer. Actually, we're not accepting any risks, and we're looking for hazards all the time, and there's a huge focus on that going forward. I think it's actually got better. Yeah, but definitely we've actually improved a lot, and yeah, I think production's up, but yeah, safety's one of the benchmarks at the moment.
Thank you, Mark. And then just a final question. Can Comcare assist Commonwealth HSRs?
Absolutely, and they should. And actually, Comcare they haven't actually had a presence in Tasmania until I think it was late last year, where they've actually started setting up a physical presence. So in the past, inspectors and Comcare were based in Melbourne and largely came over to Tasmania. There is now an office being set up in Launceston. So if you are under that Commonwealth jurisdiction, absolutely, Comcare is the regulator, and they should be responding to HSR incidents or queries or requests for assistance.
Thank you. And we'll now close today's webinar. So thank you to our presenters, Jessica Munday, Secretary, Unions Tasmania, and the HSR panel, Scott Plimpton, Support Officer, Services Australia, Centrelink, Sandy Pettit, Education Facility Attendant, Ogilvie High School, Mark Mann, Plant Operator, Munday International Cadbury, and Phil Kroshka, Intensive Care Paramedic, Tasmanian Health Service. And thank you everyone for attending today's webinar, HSR panel discussion, Making Positive Safety Change in the Workplace. At the close of this webinar, you will receive a survey to complete. We do appreciate you providing us with your feedback. Today's webinar has also been recorded and will be available on the WorkSafe Tasmania YouTube channel. On behalf of WorkSafe Tasmania and the WorkCover Tasmania Board, thank you for joining us.